And good afternoon. Once again, thanks for joining us on JB. Of course, this time of day, like always, the second and fourth Friday of the month, none other than Here Today, a show brought to you by Davis Family Hearing with Dr. Joanie Davis as our guest here in the studios. Always here to answer your questions, address your concerns. Of course, any comments you may have, she wants to be your doc. She is a board-certified audiologist. Davis Family Hearing has got 3 locations throughout the immediate area. Brooksville office on Cortez Boulevard, Spring Hill on Spring Hill Drive, and of course, Newport Richey on Little Road. So once again, Dr. Joanie Davis with Davis Family Hearing, a show called Here Today, which gives you an opportunity to hear from the experts live right here in our studio. Hernando and Pasco's only cochlear implant providers. They are board-certified audiologists, experienced Hernando and Pasco County's premier hearing care center today with sophisticated diagnostic tools available. Of course, Davis Family Hearing is equipped to meet every patient's needs from newborn to senior. And we touched a little on senior last week, Dr. Joanie. And this week, we can once again continue that and touch a little bit, maybe on the pediatrics as well. How's that?
Absolutely. Sounds great. It's good to be here today.
Good. Well, welcome back once again. And we appreciate all you do for the community and the services that you provide. One new thing I want to throw out there, we do a Rotary auction every year. Mm-hmm. And I just want to make note that let our listeners know there has been a submission into that auction, a donation by Davis Family Hearing of some wonderful looking hearing aids. Can you tell us a little bit about that?
Yes, let's talk about this.
Okay.
I was so excited. We actually received a donation from one of our hearing aid manufacturers for some Bluetooth hearing aids. They're Starkey Halo Bluetooth hearing aids. And the way that these hearing aids function is not only are they fabulous hearing aids and improve your hearing in all situations, especially in background noise. They're fantastic in background noise. But if you have an iPhone, an iPad, or an iPod, they Bluetooth into your phone or your iPad or your iPod, and you can stream music to your hearing aids. You can stream phone calls to your hearing aids, so you're literally hands-free while you're driving in the car or at any time. It's kind of neat. Your cell phone, I'll have patients in my office, and their phone will ring, and their phone will be on my desk, and I'll have no idea that it's ringing, and it's ringing in their hearing aids, and they can just pick it up, and they start having a conversation. Doesn't even look like they're talking on the telephone.
Right.
You can stream YouTube videos, Facebook videos, any audio that happens in your cell phone, you can stream to your hearing aids themselves. Goodness. So it's not abnormal for people to be walking around listening to music and nobody has any idea that they're doing that. They're literally like little, they're like toys, honestly. It's not like fitting hearing aids. It's like fitting toys.
I'm thinking about bidding on those things. That is cool.
Honestly, I wear them myself sometimes. If my Bluetooth actually broke the other day and I needed to make some phone calls on my way home from work, so I programmed myself a pair of Halo Bluetooth hearing aids, and I made some phone calls on my way home from work.
Very cool.
And the hearing aid manufacturer, Starkey, who actually developed these, when they first came out, they provided a pair to every one of their staff members because they're so cool. There's a couple of other things that it does that I'd like to talk to you about because it's just so awesome. It's my favorite hearing aid, and that's why I got them to donate it, because it's my favorite hearing aid. One in particular person in town, I won't mention their name, but has told me that she will take her cell phone to meetings or to luncheons, and you can actually activate the microphone on your cell phone and leave it on the table and get up and leave, and it has 100-foot distance of connectivity. So whatever anybody is saying around the table, your phone picks up and sends it to your hearing aids. So it's like a little spyware if you need to. Also works as a remote microphone to help you hear better in background noise. You can also, if you go to a restaurant and you're having a particular difficult time or, you know, a challenging situation where it's really noisy or a big open auditorium, you can actually manipulate your settings yourself. So you just move, you don't know what you're doing. You just take your finger and you move it around on the screen until you hit your sweet spot and you like the way that it sounds, and you can store it. And then the next time you drive to that location, your hearing aids automatically kick into that custom developed program that you've developed for yourself. So they're really specialized for each individual person who's using them. Another feature is there's a Find My Hearing Aids feature on it. If you were to lose your hearing aids, you can pull up your cell phone and it will track your hearing aids down for you. It actually gives you a Google Google map and you can find out where you left your hearing aids. So there's no more losing your hearing aids as long as they've been connected to your phone.
Unbelievable.
They're really incredible. And what I found happens with my Bluetooth hearing aids is people get their hearing aids and then walk around bragging about them because they're super cool. I walked into, it was actually Turlap Chiropractic the other day. I walked into Turlap Chiropractic and I was talking to Dr. Turlap, and he said, I was talking to one of your patients the other day who had his cell phone out and was showing me all of the different features on these Bluetooth hearing aids that he has. So I'm super excited about it. We're donating the hearing aids. We're donating the evaluation, the hearing aid fitting, and then we're providing a year's worth of service at no charge. So it's a full package, and I'm super excited to see how it goes, and I can't wait to meet the lucky winner.
Yeah, isn't that awesome? I mean, I saw that, we heard that, and we know that you're excited about it. Rotary is excited about it. Hernando County is excited about it. I'm talking about the top-of-the-line technological hearing aids, Bluetooth. I mean, it's just phenomenal. And these things are valued well over $3,000 or $4,000.
They're actually, the retail price is about $6,000 for the pair. It's $5,960 is how much they cost out of pocket. So somebody has the opportunity to get a really good deal here, which I'm really excited about.
That's awesome. And that's going to start soon. The radio auction, Rotary radio auction here, they'll broadcast it live on WWJB. That's during the day when the final bids start coming in. So keep that on your list and check it out. You can always call us here at WWJB at 352-796-7272 or online, wwjb.com. And if you want to contact Dr. Joanie Davis, she'll even tell you more about it as well. Her web address or her email, of course, Dr. Joanie Davis at outlook.com. And your web address is davisfamilyhearing.com.
Correct.
Okay, good. Don't forget her phone number also at the office there is 352-666-8910. Reminder that Dr. Davis is a board-certified audiologist and owner of the private practice here, not only in Hernando, but Pasco counties, and expanding. Davis Family Hearing has those locations right here in Florida, and her passion, of course, is creating a comfortable atmosphere for individuals with hearing loss to use for rehabilitation, offering the latest technologies and working with, of course, graduate students to help instill a love of audiology. And speaking of that, you have those interns that come in. Is that correct? They practice. Yes. Okay. So tell us a little bit more about your staff and about the interns or the graduates that come in and work with you.
Absolutely. We work with multiple universities. We are a residency site for 6 universities right now, and we make the residency site available to all universities. So we keep adding new ones every year. When you get your doctorate degree in audiology, the last year, it's an 8-year program, and that last year is full-on patient care with supervision. So I provide a site for residents to come do their 4th year residency with me. Good. Really fun for them. They learn a ton of information because we offer so much, not just hearing aids, but cochlear implants and different counseling techniques. We go out into the community, so it's a really well-rounded experience. We've worked with the University of South Florida, West Virginia University, the University of Buffalo, Northeastern University, and next year in May, actually, we're going to be working with Gallaudet University, which is awesome because it is actually a university designed around deaf and hard of hearing impaired people. Wow. At Gallaudet University, all of the classes are actually done in sign language. So my resident this year, I'm super excited about it. My resident this year is extremely fluent in sign language because the past 4 years of his life have been nothing but sign language. Right. That's priceless. When you have people whose primary mode of communication is sign language, it's really difficult for them to go get services, and a lot of times they need to bring an interpreter or there's some writing that has to be done. But to be able to go to your audiologist and have them speak fluently in your native language, which is essentially what's happening, really creates a bond like no other. I love to watch it, and I usually hire somebody on staff at all times who's fluent in sign language for that reason. We have Shyler Phillips, who's coming on in May from West Virginia University, my alma mater. So there will be 3 Mountaineers on staff. Wow. I'm a Mountaineer, Shyler's a Mountaineer, and Dr. Amanda Perkins is a Mountaineer. And just as a side note, all of my doctors have actually done their residency with me. So I typically hire these students on as staff doctors. Dr. Perkins is from West Virginia University, and she's been with us for 2 years now and has a huge caseload following her because she's just a delightful, bubbly personality that everybody loves to be around, and she knows what she's doing. She's extremely good at what she does. Dr. Michelle Frenton is from the University of South Florida, and I actually supervised her in 2012. So she has been with me for 5 years now and stayed on as a staff doctor. So I get to teach them from the ground up. My favorite part of doing that is instilling the passion that I have for what we do, because we really do have one of the best jobs on the face of the earth, the most rewarding job to help somebody be able to communicate easier with a loved one, to reduce stress from listening strain, and to watch these patients just have a significantly better quality of life, to be able to show students just how much fun that is, and to get them involved and to really make them go that extra mile for every single patient that walks through the door is such a rewarding experience for me. I just love to watch it. We've recently started taking third-year students as well. So they do an outplacement where they come a couple of days a week and work with us with patients to see what it's all about. So we have a couple of different years in graduate school that rotate through our office. We just like to send those good vibes out into the audiology world and try to make a difference on a bigger level, and influence the world more than just in our clinics. If they end up going to another clinic, they've had a chance to see just how good your work environment can be and how much of a difference you can make.
Well, once you've had the best, there's no reason to go anywhere else, and she's got the best right there at Davis Family Hearing. I've actually met Dr. Perkins, right, and met Dr. Frenton as well, and you're adding more. So remember, they are there to help you, board certified in audiology. And boy, that's a tongue twister.
It's kind of mean. I thought about that the other day. Audiology is such a difficult word to say, and when you have a hearing loss, it's hard to understand words like that. Audiology there's got to be a simpler way to say that.
Right.
Actually, people call me the hearing doctor.
That's
what most people call me. I took my child to the pediatrician the other day, and they said, "Oh, it's the hearing doctor." So
there you go.
That's it. We can just call it that.
There's the Dr. Feel Good, and of course, your Dr. Hear Good.
There you go. I like it.
So, and you talked about so many different forms of communication with the sign language. You don't really actually realize that is a communicational tool. That is a language, basically, in a way for those that are totally hearing impaired. That's how they communicate. And it takes me back to Miracle on 34th Street.
Yep.
Put the little girl on his lap, and nobody else could get through to the little girl, but Santa Claus was there to talk to her.
It's an amazing scene. It really is. It's just amazing. Everybody cries when they see that scene. You can't watch it and not cry.
It's just a wonderful thing that you do over there. Once again, this is a show called Here Today. Dr. Joanie Davis in the studio with you, second and fourth Friday of every month, noon to 12:30, and here to address your concerns and, of course, educate you on hearing loss, and, of course, their treatments there at Davis Family Hearing. We'll be back right after this, folks.
Davis Family Hearing offers a free 30-day hearing aid trial. The initial appointment is completely free of charge. We do a full hearing examination with one of our board-certified doctors of audiology, a consultation to address your specific lifestyle needs, and then a free 30-day hearing aid trial. At the end of 30 days, you can either return or purchase the hearing aids. Call us today at 352-666-8910 or visit us at davisfamilyhearing.com. Are you a candidate for a cochlear implant? Sometimes hearing aids just aren't enough. If you're still struggling on background noise or hearing your loved ones when they're not looking at you, even when you're wearing your hearing aids, a cochlear implant may be an option for you. To find out, call Davis Family Hearing at one of our 3 convenient locations in Spring Hill, Brooksville, or Newport Richey, or you can visit us on the web at www.davisfamilyhearing.com.
And thank you, Dr. Joanie Davis, for bringing that up, because we do want to touch on that topic. Cochlear implants, the only cochlear provider throughout Hernando, Pasco counties. Davis Family Hearing, right here, second and fourth Friday of every month. A program called Here Today, where you too can hear today. I'm JW here with Dr. Joanie Davis herself personally. Their doctors do make the difference, and she's here to tell you about it. Now, of course, Diagnostic Services, complete audiological examinations, hearing aid evaluations, acoustic reflect, threshold testing. Okay. And I mean, you so much there that you offer. It's just a wonderful thing. I don't know how you do it, but I know you surround yourself with a team of experienced doctors that are board certified, and that makes a big difference when you're looking at your hearing. You want to go to a professional, not just somebody on the side of the street that opened up a store selling hearing aids. It makes a big difference. And we appreciate Dr. Joanie Davis and Davis Family Hearing. And during that break there, we heard that you had mentioned the cochlear implant. Now, you also do something called bone conduction implants. What's the difference?
Yes. Excuse me. Sometimes when you wear a hearing aid, there's different implantable devices that we have. And we partner with Tampa Bay Hearing and Balance to perform our surgeries. And we'll talk about bone-anchored hearing aids first.
Okay.
Sometimes people have an ear where they have no usable hearing at all, and they have normal hearing in the other ear. Well, you can't put a hearing aid in an ear that doesn't have any hearing because there's nothing to amplify to.
Okay.
So what we can do is send them down to Tampa Bay Hearing and Balance. They actually implant a titanium screw into their skull, and we fit a hearing aid on it. Now, what ends up happening is the sound goes into the hearing aid and vibrates the bone in the skull and stimulates the normal hearing ear. So it's not abnormal for me to have people in my office who have gone 30 years without hearing out of an ear. And that creates so many challenges. When they go out to a restaurant, they have to make sure that everybody sits on their good side.
Right.
They have to make sure that they sit in an area where they block out as much noise as possible. And they can't localize where a sound is coming from. If somebody talks to them, they're not sure where it's coming from because everything's going into one ear. We have two ears for a reason. When we put the bone-anchored hearing aid on, they're able to localize where sound is coming from. They're able to hear on the side that has no residual hearing at all, and it significantly improves their ability to communicate in background noise.
Okay.
Everything is still stimulating the good ear, but because it's a titanium screw and the titanium osseointegrates into the skull, so it takes on the properties of the bone and actually becomes part of your bone, and it feels like you're hearing from your poorer ear. But you're not actually. You're hearing from your good ear.
That's incredible.
It's really cool technology. We also fit those on people who sometimes we have babies who aren't born with external parts of their ears. It's called the auricle, but it's the part that you see. Some babies' ear canals are completely closed off. Some, like Down syndrome children, have chronic ear infections, and there's just nothing we can do to clear them up. So if we put a bone-anchored hearing aid on them, it bypasses all of those problems on the outer part of the ear and directly stimulates their hearing nerve that has normal hearing, but the sound just couldn't get there because their ear canal was closed off. We bypass all of that and send all the sound through the bone, and the bone stimulates the inner ear or the hearing nerve itself.
Well, let me ask you this. Is that different than a stent? Like you hear people having stents put in?
A stapedectomy. There's something called a stapedectomy.
Okay.
And a stapedectomy is when you have something called otosclerosis. There are three middle ear bones in our middle ear space. There's three parts of the ear: the outer, the middle, and the inner.
Right.
And the middle ear is where the three bones vibrate to stimulate our hearing nerve. And it happens a lot more in women than it does in men, but it does affect some men, and it's usually postmenopausal women. But the stapes is the innermost bone, and a lot of times it will ossify or harden. So it's kind of like, I think of it as osteoporosis. Your bones are degenerating.
Right.
In otosclerosis, the bone is hardening, and the bone can't vibrate as well. So what we can do is send you to an otologist, and we usually send to Tampa Bay Hearing and Balance down in Tampa, and they actually take that stapes bone out and put a prosthesis in, and that's called a stapedectomy.
So that's totally different. A person like that wouldn't qualify for a bone conduction implant because that stapes already been replaced.
Correct.
Okay,
correct.
gotcha.
They're correcting the hearing loss with the surgery itself.
Okay.
A lot of times when you have otosclerosis, people opt to get fit with a hearing aid as well instead of going through surgery. Anytime you have a stapedectomy done, there's always a chance that when the surgeon goes in there and moves things around, that it's actually going to cause more hearing loss. So a lot of people opt to put a hearing aid on it because there's only a certain amount that bone is going to harden, and their hearing loss is not going to get worse from that disorder. So there's a couple of different options if you have middle ear disorders like that. And we sit down when the patient's in there and talk about all of the options and provide information for all of those options for treatment.
Okay, and is that something that you detect? I mean, because they're starting to, okay.
Mm-hmm. And we can detect that with a hearing test.
Okay.
A lot of times sometimes we can see it through the eardrum when we look in the ear, but most of the time our hearing test lets us know if there's any otosclerosis there or not.
Yeah, because somebody could live their whole entire life or a good portion of their life anyway, not knowing that. And you can pick that up, which is awesome. That's why you need to go in for a hearing test.
I saw one the other day. She didn't know why her left ear was worse than her right ear.
Kidding.
And I said, well, you have otosclerosis. And she had seen an ear, nose, and throat physician like 15 years ago, and she didn't remember what the diagnosis was. And when I told her, she goes, oh, I remember a word like that. And then I explained what the disorder was.
Wonderful, wonderful. That's why it makes a difference between seeing a board-certified audiologist compared to a hearing aid specialist, I guess you would say.
Well, typically, if you go into a hearing aid specialist, hearing aid store is typically what I call it. They're just going to go straight to a hearing aid. And actually, I had something happen the other day. Somebody came in and tested. They were told from a hearing aid specialist that they needed hearing aids, and the hearing aid specialist tested their hearing, and they had impacted earwax in their ears. So we were able to remove that and get in. There was some hearing loss, but not nearly the degree that they told them that there was. And it's just a difference in education. It really is. We want to make sure that we eliminate those medical errors, and unfortunately, I see those come through my door occasionally.
Well, I'm sure people just out there to sell shoes or hearing aids, basically. Anyway, so let's move on. We got bone conduction implants we just discussed, and next would be that cochlear implant. That would be the Cochlear.
Yes.
That's what is that? It's just called Cochlear.
It's called a cochlear implant. Okay. Is what it's called. There are three different manufacturers. Cochlear. So it's confusing. A cochlear implant, an advanced bionics cochlear implant, or a Med-El cochlear implant. Okay. And this is for people who don't benefit from hearing aids. Sometimes we can have so much distortion in our ears that a hearing aid is just amplifying more distortion. And these are the people that you hear that say, when I go into background noise, all I hear is the noise, and my hearing aids makes things louder, but they don't make things clearer. Well, the reason is because the hearing aid is sending louder sound to a distorted system, so we get louder distortion. What we can do with a cochlear implant is absolutely amazing. We go in and insert electrodes into the inner ear, bypass the distorted part of the ear, and electronically stimulate the hearing nerve itself. So you're actually hearing electrically instead of acoustically. This is probably the single most rewarding thing that I do, and they call me the cochlear implant audiologist because these days my schedule is turning into nothing but cochlear implants.
Oh my goodness.
But it's a process. It takes about a year for the entire process to take place. Once the surgery is performed, we're able to turn the device on 2 weeks after the surgery is performed. And when you first turn a cochlear implant on, it's not like it's like, oh, I can hear. It's electricity to your hearing nerve. So it sounds like electricity to your hearing nerve. Yeah. It sounds like beeping, or I had one person say it sounded like bongo drums. But it's interesting to watch them because they immediately understand better. It just sounds foreign to them. Now, the brain is a really interesting thing. It's very plastic, and it adapts very well. After about a month, sound is starting to sound natural. After 3 months, that person is really communicating a whole lot better and understanding speech a whole lot better. After 6 months, they're super happy. They're doing really well. I just saw a guy yesterday for a 6-month checkup, and I hadn't seen him in 3 months. And I looked at him, I said, I am floored with how well you're communicating with me right now. And he said, yeah, it's a huge difference. Wow. It really is. And then after a year, your brain has 100% adapted to that new sound. And when you put it on, it sounds normal to you, even though you're hearing through electricity.
Right. That is just incredible. Cochlear implant, and all this above and beyond free 30-day trial.
Absolutely.
How can folks get in touch? We've run out of time. I apologize, but we're going to pick up on this next time. But how can our listeners get in touch with you?
The easiest way is to call 352-666-8910, and our lovely phone assistant, Jennifer, will answer the phone and get you in for an appointment that's convenient for you. You can also send us a message on davisfamilyhearing.com. We have a Facebook page you can send us a message on, And you can always email me directly. The easiest email is davisfamilyhearing@gmail.com. That's the easiest one to remember. So there's multiple ways, and feel free to reach out. Get on the website. There's a lot of information about what we talked about today. And if you have any questions, just send us a message, and we'll get back to you within 24 hours.
And she'll be back again next time, folks. That's Dr. Joanie Davis with Davis Family Hearing, here to help you, here today and here always. Dr. Joanie Davis, thank you for being in the studios with us. Once again, we'll see you next time. And don't forget to check out Davis Family Hearing. You heard it here on JB Radio.